could you please tell me who you are?
I am Helen Haskell. I'm president of Mothers Against Medical Error, which is a South Carolina patients organization in the U.S.
And may I ask, what is the reason for your activities in patient safety?
I became involved in patient safety following the death of my child from medical error in November of 2000.
And what happened?
My son, Louis Blackman, went to the hospital for surgery, elective surgery, to correct a defect of his chest called pectus excavatum. So his chest wall didn't grow straight, and it was an optional surgery just for cosmetic purposes. And he died after the surgery from a perforated ulcer caused by his pain medication. And he deteriorated, his condition deteriorated for about 30 hours before, well, no one ever came, no one ever treated him or paid attention to him until he died.
And what happened after he died?
After he died, about 2 months after about a month after he died, they had told us it would take a month for the autopsy to be finished. And so we went down after a month and talked to the doctor. And the doctor didn't really understand what had happened, but we told him because we were doing research. We realized the drug, ketorolac, an NSAID painkiller was what
So you knew before the doctor knew
we did.
about the cause of his death?
About the
Tragic
person's
death.
We had put it all together because the doctor didn't realize everything that had happened with the failure to rescue. He didn't understand how severe his symptoms had been. And once we explained it to him, he immediately took responsibility. And he said, "This is our fault. No, don't blame yourselves." It was really quite noble of him. And from there we never had a lawsuit. The university settled with us. And they helped us. We passed a law in my son's name. And eventually they endowed a chair of patient safety, a professor of patient safety.
I see. So they really took, first of all, they acknowledged the error. They gave you information.
They gave us what information they had. They didn't have we really had more information, because if it's your error in your case, you only have one patient that you have to do research on. So if you're researching your own case, you research it in great depth. So we really knew more about it
You as parents?
As parents, we knew more about what had happened, as is often the case.
Yeah, yeah. And so the tragic loss of your dear son made you to become active in patient safety?
We did. It was to keep his death from having been in vain.
Yes, I understand.
He was we had many hopes on him. He was a wonderful boy and a brilliant boy. And, we expected a great future for him. So this was all we could do, just to hold up to any possibility of the future.
Yes, and to hold on to his beloved memory.
To his memory.
Yes, and to live with the tragic loss.
Yes.
Yeah, I understand. So you set up Mothers Against Medical Errors, and what are your activities?
Well, we do a lot of things. We're much broader based in our activities than most American patient safety organizations, I think. So I've worked in medical education, resident work hours, working on supervision and fatigue among residents in particular, but all medical personnel. We've worked on rapid response teams. That's been a big issue to respond to patients like my son Lewis, who were declining, and the bedside nurse just didn't understand what was happening. And we've worked on infection. We passed a law in South Carolina and worked nationally on public reporting of hospital-acquired infection. We create educational materials for patients. And we work on full disclosure of medical error. That's been a big one.
Yeah. And apparently, we're now in Paris. You attend this major conference, and what is your form of participation and contribution?
I'm just here at the meeting because I'm on the board of IHI.
And since when are you on the board of IHI?
This is my first meeting.
Your first meeting. So, but I think it's a major development that IHI has asked, let's say, a representative of patients on their board.
I think it is. I think it is. Yeah, they definitely are moving in that direction. They're very patient engagement, as they call it, is really very important to them, and they want to have patients a lot more involved throughout the healthcare system. That's one of their goals.
Yeah, so I understand you will promote improvement of the position of patients and victims. Could you summarize maybe some of your solutions to the improvement?
Oh, that's hard to say. You know, I've worked on so many things. I think transparency is really essential. Patient reporting of incidents is key. The patient voice throughout the medical experience, from the time people are going to the doctor to when they're in the hospital. Having patients as highly educated as we can make them. I mean, there are a lot of things that need to simply be public knowledge. How to, a lot of basic medical knowledge that people are often lacking. So they don't understand, for example, the signs of shock and sepsis. I think everyone should know that. When I was a child, we took first aid. And that was part of it. But it's just a very simple thing, the signs of shock and sepsis. You know, people should know how to navigate the system, who's who, and who to call when they need help. So the education of patients and those things, and the education of medical personnel to treat patients as equals, and to realize that they are advisors. They're not dictating policy.
They're partners, one would say. That's, so one could discern between the phase, let's say, as a regular patient, and one could discern the phase as, let's say, unfortunately becoming a victim of, let's say, medical error. What would your recommendations be after the medical error?
You know, in the U.S. there is a strong movement toward full disclosure of medical errors, and in fact it is required by the Joint Commission, our accrediting body, our main accrediting body. So my first suggestion to patients would be that they go to the hospital and try to open a dialogue with them. Now they might have more luck with hospitals than with a doctor who made an error in office. That would be my first suggestion, to try to do that, to work it out with the hospital without filing suit, to try, because often they will, even if they weren't trying to initiate such a dialogue themselves, they might be receptive with the patient's suggestion. But you need to be cautious, but I think that's the first step. After that, there are no good solutions really. I mean, there are agencies you can report to. You can eventually resort to litigation, but none of those things have much effect, and they're not easy.
No, the situation of the victims is very difficult. Are you aware of the problem that patients not only do not get, in many cases, honest information, but also are being refused adequate medical care after medical error?
I have talked to patients who've suffered that. Yes, I am aware of it, and it's an intractable problem because no one talks about it primarily. It's a significant problem.
How can one prevent unnecessary harm to patients who have already become victims? How can one prevent that additional harm by the refusal of honest information and remedial medical care?
That's a good question. I don't know. I mean, I don't know the answers. It's a difficult situation. I mean, I think that perhaps with greater regulation, but it is it's an area in which the patient's always going to be at a disadvantage.
But maybe, would there be a role for education?
Yes, I think so. There's a lot that can be done in professional schools, in medical school, nursing school, particularly.
Yeah, that's so. Could one say that there is still reason for optimism?
I'm always optimistic. I think there's things have changed a lot in the 10 years that I have been doing this, and I think they will continue to change.
Yes, we are on the road to change, one might conclude.
Yes, that's true.
I think. Thank you very much.